So today I want to take you through my go-to exercises when my low back is feeling tight, but I'm not sure why. Now, understandably, you'd assume to look directly at the area that is causing your pain, your low back. But actually, there's a lot of research that supports how limitations in other areas of the body are often the main culprits. So I'm going to take you through a routine that will help you test if you have any limitations or discomfort in these 4 areas. Make sure you have a yoga block and resistance band ready to go, and let's get to it.
Okay, let's get straight into it. What I want you to do is place your hands on the outside of your knees and you're going to push against your knees for 10 seconds. This is called an isometric contraction where there's no movement happening, but you'll feel that the muscles on the outside of your hips are engaging. So keep pushing for 3 more seconds. You're then going to put your fists together and place them on the inside of your knees, and you're going to actively push your knees in towards your fists for 10 seconds. Now you should feel the inside of your thighs are engaging. Just a few more seconds here, and then we're going to repeat both for 2 more times. So we're pushing on the outside of our hips, or the hands on the outside of our knees, but the outside of our hips are engaging. A few more seconds here, and then place the hands on the inside. We're pushing against our fists, firing up the inner thighs. You might also feel your core engage here, so just make sure you're still breathing. Very good. Okay, so taking it on to the last set, push on the outside against your knees. Try not to let the knees come in. Try and keep that gap between them whilst you keep holding this contraction. And then last time, hands on the inside. So you want to build up towards maximum contraction here, but you might not want to do that right away. So if you're feeling like this is way too much, just scale it back for next time. Okay, we have a short rest, so what I like to do is just straighten one leg at a time as I've just had my legs bent. We are going to go back into that position, so take more time resting if needed. Otherwise, what we're going to do now is another SI joint release. This is going to involve staggering your legs like so, but what you're actually going to do is press one hand against your knee and the other hand is going to pull the other knee. So whilst you're pushing against one knee, you're pulling the other. Just going to do that for a few seconds and then you switch. So it's a pull and a push on opposite sides. Pull and push. It's only a couple of seconds. I just want you to carry on doing this for up to 4 sets in total. So on the 3rd set now, feel free to pause me at any point if you need more time. The first time you come to do this is really more about getting to grips with what the exercises are. And then once you've done this a few times, you'll be able to follow this without much info from me. So just take some time to gently rock your knees side to side, whatever feels good for you. Then when you're ready, you're going to need a yoga block or cushion, anything that you can put between your knees. And we're going to work on your thoracic mobility, your upper back. So we're squeezing the block between our knees so that they don't come away from each other. You then want to reach forwards and then reach back behind you as you rotate only through your upper back. Try not to twist through your lower back. You're going to do this 5 times and then you're going to hold the last one for as long as what feels good. So don't worry if you can't quite touch the floor on the other side yet. This is your first sign that this is something you need to work on if you do find this challenging, especially if you notice differences between the sides. If you're up for the challenge, we're going to progress after this though. So once you've done holding, we're going to progress to some semicircles. This is where you'll reach forward, up above your head and round back behind you. This will give you a much deeper stretch into the chest and the shoulders as well as your upper back. So the challenge is to try and keep your finger touching the floor the whole way round. But again, don't worry if you can't do that yet. Just go into what feels like a comfortable, dynamic stretch. And if you are noticing tightness here, I suggest you make notes of everything you notice about your body as you go through this session. Maybe literally write it down. This is going to be a useful test for you to know where to put your attention to for your lower back. So we're working towards 5 reps in your own time. Again, you might want to hold the last rep if that feels good for you. And then we're going to progress and do the same thing again on the other side. So when you're ready to go to the other side, make sure you engage your core, slowly take your knees over. And then we do the same again. So you're going to work on 5 twists, reaching forwards and then back behind you. And you'll be able to see my arm a bit more clearly now, how I am able to touch the floor without my knee lifting. If it helps, I don't know if you can see, with my other hand, I'm holding the top of my knee just to make sure it's securely staying down and I'm not sort of cheating the stretch. Again, if you could draw a line through the middle of my body, you'll see I'm only moving from the upper part of my spine. I'm really keeping my lower spine still. Where people often go wrong with this, it can actually aggravate your back a lot more. Really try and work on being able to isolate your upper back. So once you've done your 5 twists and you've held it for as long as what feels comfortable, we then progress into those 5 semicircles if you feel ready for it. Again, long-term aim, being able to touch the floor and reach round. But don't worry if you're not there yet, you might find your hand hovers above, as long as you feel that nice stretch into the chest and the shoulders. And again, if you get any pain or discomfort in the shoulder as you're doing this, that's another sign that your body's trying to communicate with you, so make sure to note all this down. Okay, so once you're done holding this last rep, we're going to progress into side lying leg raises. So it's not all about stretching here, we actually want to activate some of the muscles, especially the important glute ones. So your glute med is the muscle on the side of your hip. To work this, what you're going to do is lie on your side and just lift your leg high enough to feel that muscle engage. It might help to place your hand on your outer hip so that you can feel that muscle squeeze. Just going to work up to slow and controlled 10 reps on each side in your own time. But what I encourage you to do is to make sure that your big toe touches the floor in between each rep. And really be aware of where your positioning is. You should be in a straight line from your heel to your hip to your head. If you find that your foot is starting to come forwards, that's a sign that your body is compensating and perhaps you might not be strong enough for this yet. That's another thing to write down, and we can discuss this more, what you can do next at the end. So when you're ready, transitioning onto the other side for another 10 reps, we're going to go for 2 sets of this in your own time. And if you're feeling actually it's quite easy, that is great. What you can do to make it harder is just hold each rep for longer. So you might work up to 5-second holds. That will quickly get much more challenging. But also a good sign if there isn't any problems here. It could be that your back pain isn't being caused by any instability in the hips. It could be another reason. That's why it's so hard to make a routine that suits everybody, because your back pain or back stiffness could be there for a number of reasons. But hopefully in this session today we're covering enough of them to try and work things out. So we're back to the right leg if that's what you started with. On to your second set, which will be your last set for today. And you might be starting to feel it more now that you've already pre-fatigued the muscle in the first set. It might be starting to get hard now, which is great. It really should be. The last few reps of each set are quite challenging to complete. So if you're getting through it quite easily without really much of a fuss, then probably this is too easy for you. So like I mentioned, you can hold for longer or even do more reps or even an extra set if you have the time and want to pause this. But if you're sticking to 10 reps with me, let's do the other side. And I want you to really focus now on making sure, hopefully before this you have been, but definitely by now you're putting that mind into the muscle, making sure you're feeling it in the right place and just taking your time. Okay, well done for making it through that important glute set. We're now going to go back to the upper back, and I know you might be thinking, like, how has this got anything to do with my lower back? It will all make sense by the end of this video. So starting in this all fours position, hands under your shoulders, knees under your hips, core is braced, we want no arch in your back. Keeping your arms straight, you're going to bring your shoulder blades together and then you're going to push them apart. They're like little mini push-ups. So what you should feel is the muscles squeezing as your shoulder blades come together, and you creating again more of a stable platform as you kind of push the ground away. So you just want to feel that movement basically in the upper spine. 10 reps, and then we're going to progress onto a rotation exercise once we're done. So you might have heard of arm weaves before. This is like another variation where we just focus on the twisting upwards. And what's really important here is that both hip bones stay facing the ground. I don't want to see any rocking side to side where your knees are lifting off. You just want to be braced into that ground. And you're only rotating as far as you feel comfortable to. So you might not be going as far as me here, but again, that's another thing to note down, especially if you found difficulty with the exercise we did on the floor where you twisted at the beginning. There's likely a link there that there is some restriction in your thoracic rotation, and that can have a big effect on your lower back because, as we know, or you might not know, everything is connected, and when something's not quite functioning properly, that's going to change the way that we move in other areas of our body as well, which is why we're looking at the full picture today. So as you can see, we're back to those scapular push-ups. We're here for set 2, and then this time we're now going to twist to the right side. So if you're noticing actually one side moves quite well, but the other really doesn't, that's another sort of red flag that your body is trying to give you, just to let you know, right, something's not moving right here. Make a note of it, and then you know what to focus on with your training. So it's quite a good pre-session warm-up to do, this little superset we're doing here. So if you want to do it at the beginning of your training sessions, or maybe even as a movement break if you're working at a desk. Right, we're going back to those scapular push-ups. Make sure your core is braced. So set 3 now. We're doing about 4 sets total of these scapular push-ups with alternating each side of the arm moves in between. So hope it's making sense as you're going. It should be getting quite warm now, surprisingly. This can get quite challenging, especially with the combination and not much rest between. So if it's too much for you, just pause the video, take a rest. There's no rush here. You've got something to work towards. And if it feels quite easy, that's also great. Just consider it a good movement break. So as I mentioned, after this rotation set, we go back for the last set of scapular push-ups. Then you've got one more set on the other side, so I'll let you complete that in your own time. Okay, and if you found that superset a little bit intense on your wrists, let's take a moment to rest and just sort of roll them out. That's another thing to note down. If you struggle with putting weight on your wrists, it's another connection to the body. We are going back to another wrist-bearing exercise though, so if this is too much, you can just skip it for now. But I'm sure you might have come across this exercise before. We're going to do a bird dog, or I used to also call it Superman's for obvious reasons. So you're reaching one arm forward and the other leg back. Really important to keep the hips steady and not let them rock. Also notice how I'm not arching my back either. What I'm thinking about is reaching my heel to the back of the room and my other hand to the other end of the room. So creating this nice long line across my body rather than thinking about trying to lift the leg up. And I'm also incorporating my breathing practice here. So what I suggest you do is that you work on breathing in as you touch your knee and then breathing out as you reach away. So that will also encourage you to keep the reps slow and controlled. And as you can see on the screen, you should be doing about 10 reps on each side. When you're ready, we're going to switch over. Oh, there's me showing you how to do it wrong. So you see how I'm arching my lower back? That's just going to aggravate your lower back, and that's not what we're trying to achieve here. So this is a good opportunity to practice your core brace and your breathing. And rather than me explaining it here, what's probably best is I'll leave a link in the caption of this video taking you to the core brace video, which will teach you more about breathing and how to activate your core effectively. So if you're struggling with this right now, pause the video and go watch that one, because that's going to help you with this. But if you're okay, let's carry on. We're doing 10 reps on each side, and we are going to go for 2 sets of this today. And just to remind you, you want to breathe in as we touch the knee, out as we reach away. And what might also help your wrists as you're putting weight on them is to think about actively squeezing the floor with your fingers, because that's going to help engage your forearm muscles. Let's have a little roll out of the wrists. Again, pause me if you need before we get back to the second set. So yes, you want to grip the floor, and you also want to think about pushing the floor away through your hand. That's going to create a more stable base with your shoulder blades. So let's carry on with one more set on each side. Okay, so we've mostly covered the upper body, the thoracic spine, your core, all important elements when it comes to lower back pain and stiffness. But arguably, the most important area to look into is going to be your hips. So I want you to start in this lovely position with your legs wide, feet wide even. It's going to slowly drop one knee in at a time. Notice how I'm keeping both knees at 90 degrees. If you get any knee pain during this, stop, note it down and let me know. But otherwise, hopefully you should be okay. It's also totally fine to lean to the side if you feel like you can't sit upright. So just make it work for you, and just work on trying to feel the muscles that are activating as you do this. You eventually want to work towards being able to lift that back knee each time that you roll forwards. In fact, the thing I'm going to show you now, you're going to hinge forwards when you're ready. We're going for 4 reps on each side. Lift the back knee, transition over, and then fold forwards. So we're not just passively moving our legs through this. I want you to think about activating the muscles as you do so. So if you are doing these leaning to the side, what is likely the reason for this is your back leg in this position. So, for example, when moving forwards now, it's that left leg. If you're leaning to the side, it's likely because you are restricted in hip internal rotation on that leg. So it's either both sides are the same or maybe one side is tighter than the other. So again, make a note of that. Hip internal rotation is tight. And if you get a lot of discomfort or really struggle with the folding forward part, then that would suggest some limitation in external rotation on that front leg. So we're going to move into a passive stretch for external rotation of the hips. So we're progressing this further. And if you are tight in this position, I want you to use a strong resistance band like I am. Loop them around your knees like so. We're going to hold this stretch for roughly 30 seconds to a minute. I've got my heels pressed together, so you might not be able to see that from this angle. And I've got my back flat against the wall. So if you find that your hips are tucking under, that is a sign of restriction there. So what you might want to do is sit onto a yoga block or a cushion, just something to lift your hips a bit higher than your feet, and you should find that more comfortable. The goal here with any passive stretch is to try and relax yourself, relax your nervous system. That tight feeling you're getting in your hips, that is your body basically trying to protect itself because it doesn't think you're safe to go much further. But alternatively, if you can get into this stretch quite easily and your knees are quite far down like mine, and you can do this test and get your thumb to touch your forearm, I can't because I'm not hypermobile, but if you can, that would suggest that you might be hypermobile. Or especially if you generally find stretches quite easy, that is likely going to be the case. If you're not sure, send me a message. So if that is you, or if you're someone that is ready to progress this, we're going to make it active. So I want you to follow this movement like I am. You're going to push your hands down against your knees, and that's going to activate your inner thigh muscles, your adductors. You're going to work up to 10 reps of these. Just slowly in your own time. Notice how I'm not pushing my knees back down again. We're only going for one set of this, but I really want you to just get used to this feeling of activating those muscles. And this will be an important exercise to add into your strength training routine if you struggle with this. Adductor weakness, adductor tightness, your inner thighs. There's so much research out there that links this to the development of low back pain. So don't sleep on this. If you are noticing this is an area you're struggling with, you need to work on this more. And if you're hypermobile, you need to work on more strength work rather than pushing into stretches. Next exercise, moving on to the sciatic nerve stretch. This is another important area to cover if you are getting any back pain, especially if you're getting referred pain down the leg. That's definitely when you need to go see a professional in person. But if you want to just give this a go, do it as a test, what you do is you just, as you can see, I'm flexing my foot and tucking my head in. And what you should feel if you are tight is almost like you can picture that nerve running down the back of your leg. That tightness there is tightness in the sciatic nerve. If you don't feel it, that's good. You don't have a problem. Maybe tight hamstrings, but you'll know the difference between nerve pain and hamstring tightness for sure. And if it causes you pain, please don't do it. But if you feel okay and you feel like it's helping you, we're going to go for 2 sets of this, 10 on each side. And the aim is just like a dynamic stretch that you would do. Aim is to just gradually ease up that tension. But it might not happen right away. It might be something that you need to add in as a morning, afternoon and nighttime routine where you do this exercise. You can do it sat on your bed as well. If you struggle to get into this position where it's hard for you to bring your knee into your chest or to bend your knee this much, then that's a sign that you are restricted in knee flexion. There's so many elements to look at with the body. It's just good to note down, right? Okay, I really struggle with being able to bend my leg this much. In fact, I actually get a lot of knee pain. Maybe that's connected. So anyway, I'm digressing. If you do find that your sciatic nerve is tight, this exercise alone is not going to fix your sciatica. You're going to need a gradual program where you gradually build strength in the hamstrings and the posterior chain. So that's the muscles down the back side of your body, includes your glutes as well. So yeah, it's a slow, gradual approach for that. And I've been there before. Sciatic pain sucks. So if you are experiencing that, let me know because I can give you some advice because I've obviously got experience in it and this is what I specialise in. And if you need a program, just speak to me. But otherwise, if you're not sure, go see a professional in person, ideally a physio, who can at least diagnose your problem. Okay, I can only help you when you're at the point where you need an exercise routine. So I hope you're working okay through your second set. If you didn't really feel it much, you could probably skip this next time. What we're going to progress to next is a gentle glute stretch. So the glute I'm referring to, or the muscle it's not really a glute muscle, but it's a muscle of your hips, is the piriformis muscle, which often gets referred to the glutes just because of it basically being your sort of inner buttock muscle. Maybe I'll try and get a picture up on the screen for you. So you're going to bring your knee towards your chest, across your leg, and then pull it into your body. If you're struggling with this position or if it causes you pain, stop, because this could be more of an issue to do with your piriformis rather than it is to do with your lower back. So it shouldn't cause you pain, it shouldn't cause you aggravation. If that's the case, message me. But it should just feel like a good gentle stretch. You want to hold for about 30 seconds on each side. Oh, there's the countdown timer. You've got less than 10 seconds left if you started with me in the video. I appreciate there's a lot of talking and you probably got to pay quite close attention to what I'm saying here, but that is the point. I really want you to learn from these videos of how you can approach your training if you are in pain. So if you haven't already, switch over to the other side. We've got 30 seconds on this leg. And the reason I don't like to push this for much more than 30 seconds is that it is possible to overstretch the piriformis. So if you find that you've been stretching and it's not getting better, then you're going to need strength work. But that's not included in this video because I can only include so much. So if you think you might need some strength work, let me know. 5 more seconds. Okay. Make sure you're keeping note of anything you've noticed. We're moving on now to a hip flexor release. So we're going to start in this half kneeling stretch. We're going to hold for 30 seconds on each side and we're going to progress to 2 sets. So make sure your hips are tucked under. You're going to flatten your foot and gently push down into the ground for more of a stretch if you need that. And just be conscious that you're not arching your lower back because that's how the body compensates when there's tightness in the hip flexors. The back will arch to help you get into certain positions, and that is what often aggravates a lot of people's lower backs. Tight hip flexors, as probably most of us know, very common in people who sit for long periods each day. So really important to, when you can, to open out the hips like this. So less than 3 seconds, and then we're going to change onto the other side for our first set on our other leg. So tuck those hips under, untuck the foot, gently push down into the floor for more of a stretch. And again, just like the butterfly stretch we did earlier for your inner thighs, you want to work on slowing down your breathing, trying to relax your nervous system, encourage the body to get used to these positions so that it can gradually feel safer and safer. This stretch alone won't necessarily fix your low back pain because I would encourage you always to incorporate strength work into your week. But as a movement break and to release any tension for the lower back, this is a great go-to. 3 more seconds, and then we're moving on to the second set. So if you're ready for it, in the second set, we're going to add in some alternative options that you can add if you want more of a stretch. So for example, if you want to feel it more, you can raise your back foot onto a yoga block or even onto a chair, which would be a deeper stretch. Make sure you can still tuck your hips under. This would be even deeper if you can hold your foot. Might be quite uncomfortable on a hard floor, which is why I don't end up holding it very long here. But so imagine if that was on a chair, that would probably work better, really, wouldn't it? So that's a way to get a deeper stretch into the quads, so the front of the leg and the hip flexor. Alternatively, we can work more into the side of the body as well. So if you reach your arm up and over, that will stretch down your side, which can often get tight with the lower back, and then down into the front of the hip flexor. So you've got a few more seconds left. You can work on maybe 10 reps in this set, or if you want to, you can even play with twisting your body. Just wherever feels best for you, because it will be different for each person, which is why I try to give these options. On to the last set, tucking the hips under, foot raised if you feel ready for it, or you might be doing the reaching over maybe for up to 10 reps, or you might be doing that twist that I showed you in the end of the last set. Make it work for you and work on trying to gradually relax your body into a release in that hip flexor muscle. Okay, last up, I think it's important to end with something active for the lower spine today. But consider this almost like a massage for the lower spine too. So we're going to do some glute bridges, but by curling the spine. So position your feet so they're not too close to you, not too far away. You can raise them as well using a block, or maybe even place them on a chair. That can make it more comfortable for your lower back. When you're ready, you're going to tuck your hips under so that you flatten your back into the floor. You're then going to slowly lift your hips off the floor, then your lower vertebrae up through to your mid vertebrae, one at a time, until you get as high as you can without arching your back. So what we don't want to do is this. Don't want to aim for height here. Keep those ribs pressed down and just aim for where you can feel your glutes engage, which could be if you just stop there and squeeze them. So it could just be a little roll off the floor and then curl back down, which is that lower back massage I mentioned. But when you feel ready, you want to work up to pushing down through your heels, tucking your hips under, and then squeezing your glutes to the top. If you're struggling to feel your glutes, hold it a little bit longer because eventually you will feel them, maybe even the back of your legs as well. And if it's causing you back pain, have a look at your position, maybe film yourself, see what you might be doing wrong. Your feet might be too far away, for example, or you might be arching your back but not having realised it. That's why it's good to film yourself and just see what you're doing. But take your time with this. I've put 10 reps, but it could just be 2 reps for now, and then eventually build up to 5 until you can eventually do 10. The idea of this routine is that you can work through it, make note of like what's not working well for you at the moment, so perhaps you can go away and work on that separately. When you get to the end, hug your knees into your chest. But also you just want to learn through this routine what works best for you and what you can adjust. So use this as an opportunity to learn more about your body.
Okay, well done. What did you notice during that? Did you struggle with any of the exercises that targeted your thoracic mobility, your hips, or even your core stability? Or maybe did your sciatic nerve and piriformis feel tight? Or did you actually find that your joints might be hypermobile? This is all useful information to have, as now you know what to focus on in your strength and mobility training. And if you're not sure where to start, this is where I can help with personalised coaching. Or you can learn our methods for yourself by completing our mobility training and low back pain course. I'll make sure to include all the relevant links in the caption. And please do like and comment any questions that you might have. And make sure to subscribe so that you get first access for my next video tutorial coming next month. See you next time.